Yes, all those lines that you can see, they're all the cerebral vessels marking. You can see middle meningeal artery marking also. So there is a point at the back on the front here that's called pterion. If there is a damage to that point, then it will, damage the middle meningeal artery inside. So that markings you can see on the skull. And you can also see the foramen ovale here. Okay, you can see foramen, ROS actually it is. Rotundum you can see, ovale you can see, and you can see spinosum also. Okay, so this is tentorium. So see here, you can see the small, opening. What is that for? The straight sinus probably. The straight sinus. Okay, there are transverse sinus and occipital sinus. They are the ones which are present here. And you can also see all these other structures, like you can see the pituitary fossa. That you can't see here. Okay, you can see the odontoid process, you can see the atlas and all these vertebrae. The spinal cord has gone with that. So you can see this khali here. This is the intervertebral disc. And trachea, can you see the sinus of larynx here? There is a slit. All of you take that properly. This is called the sinus of larynx. Okay, we produce voice through that sinus of larynx. And then you have the tongue, and then you have hard palate, soft palate. This is the nasal septum. Can you see this? If you remove this, you will see the lateral wall. There is only one nasal septum. So with that section, we didn't see that. Okay, so that's it. And what is this? The Orbicularis Oculi. What is this one? The temporalis coming. It's a fan-shaped muscle. Can you see the fan-shaped? This fan-shaped muscle. Okay, this is Orbicularis oris. Can you see this gland? What is this gland? Submandibular. Similarly, there is parotid, and all the facial nerve branches will come on the face like that. And this is sternocleidomastoid. And you can see the sublingual submandibular. Can you see this? That is, what is that? Submandibular. Submandibular, sublingual will be very close to each other. You cannot make out actually. So you can see the other structures also you can make out. You can see the facial artery. You can see. Oh gosh. That's all. See, this is the digastric. Okay, there is anterior belly and the posterior belly. The